For my literary review, I decided to discuss and research increasing compliance while treating childhood obesity. It was a little difficult finding my topic just because there are so many that could be relevant to leadership and to the healthcare field. Um, After doing a lot of research on relevant topics, I kind of decided this one because I feel like it's not something that gets discussed enough, and it is so relevant in our society and where we'll be in any aspect, no matter what field um, we decide to go into. I found that the biggest issues in compliance were with communication. In my interview with Susan Johnson, she's an RN, has her MSN with a focus in pediatrics. She said that a lot of the time people, especially like nurses and doctors, do not feel comfortable really stressing to parents that the child is overweight, needs to, you know, get back to a healthy range because parents can become defensive, and it kind of ruins that relationship sometimes because parents don't want to hear that their child is overweight because they think, oh my gosh, have I been a bad parent? Is it me? Which isn't always true. Maybe there have just been life things that have happened and this is where we're at. Um, or the nurse may bring it up and say, this is where we're at, this is where we want to be at, but won't offer further services, which are available all across the country. Um, a lot of the time, the parents' own denial even can get in the way of treating their child's obesity. And one of the studies that I did, or looked at, excuse me, um, over 300 parents were asked to take part in a study that would kind of look at and try to help treat and further compliance with their child's obesity. Over 300 people were asked, and only 19 participated. And this kind of proved that parents, they just think that, oh, their child will grow out of it, oh, this is something that they can fix on their own, they don't need extra help, when really they do need extra help, and it's okay that they need extra help. Um, Sometimes we'll do this teaching, but the parents won't understand it, and there's several reasons why. There are so many barriers that exist when doing patient teaching, and this is something that we learn from day one but don't really sometimes think about. So before we go into the room, we need to look at the ages of both the child and the parents. Maybe the parents have done their best to teach their child that how to eat healthy, but the child's 16 now and he wants to go out and you know drink pop. So sometimes the child needs to be held at more responsibility due to their age. Or maybe the parents are older and they don't know how to care for a child like maybe a younger parent would. We also need to look at the child's growth history. So, is this something that's new that has just popped up? And if so, why? If this is something they've been battling their whole life, let's look at the family's growth history and their health as well, because this is a multi-factorial thing we need to take care of, because we can't just take care of one person and expect the whole family to follow along. We have to do it on a whole family-based level. We need to look at living situations. Do they live in an apartment and maybe the kids don't get outside like they would if they lived in a house with a yard? Do they live in the city and maybe don't have as much access to fresh food rather than McDonald's? Let's look at their socioeconomic status. If there's only one parent and they just got laid off and they go to the grocery store, ramen noodles and chips are cheaper than buying fresh vegetables and fruits. So those are definitely things that we need to look at, and each study kind of stress that, like, let's look at what is going on and ask, why is this child either at risk or currently experiencing the effects of childhood obesity. So to improve compliance, we really need to do effective teaching. And like I just said, we need to look at what's going to be a barrier in this situation. We need to be very non-judgmental and say, stress. I want to help you. Understand this happens, and we're going to help you out and treat it, and be very compassionate in the way that you handle it. Um, we need to offer further services because there are so many that are available. In one of the other articles that I looked at, the school-based health centers, they're all across the United States, and they're implemented into schools where children are a good majority of their time. So maybe try to see if there's any close, or if there are any, kind of social or public health services that are in their community. Um, we also really need to lead by example. So not letting them see us down a Red Bull right before we walk into the room, and really kind of be knowledgeable about the teaching that we're going to do and try to live our own lives like that, because that's how our patients are going to kind of build trust up for us. In both of the articles that I discussed, the school-based health centers were definitely more effective and kind of had better outcomes because it was so widespread across our country. But there still needs to be more knowledge about them, because what goes on at school, the child may say, yeah, I'm going to do this. Yeah, that's so great. Well, you need to get the whole family on board, as I kind of said before. So there's that. And then another downfall is it's hard for the nurse. You can see who is already affected by childhood obesity, but we need to really look at who's at risk, because that's how we're going to treat it before it happens. So those are just kind of ways to help further the compliance with this situation. I feel like once we start understanding that, and especially understanding the barriers to this, is when we will start seeing more change.